So before we move on to the next session, I must mention Ms. Dolly Bishash. I do not know how many of you are aware of. She has received Florence Nightingale Award from the Honorable President, and we are really honored, ma'am, that we have the opportunity to work with you, and thank you for joining us today. So the next session is on a panel discussion on making healthcare efficient with good governance and higher investments. The session would be moderated by Ms. Nisha Bhatia, Senior Director Health Industries, PwC India. And in panel we have Ms. Dolly Bishash, Dr. Pinaki Bandyopadhyay, Medical Superintendent, HP Ghosh Hospital, Mr. Indrajit Banerjee, Group Head and Associate Vice President Marketing, Peerless Hospital, and Dr. Joydeep Bhattacharya, Chief of Medical Services, Ruby General Hospital. So I would request the moderator, Ms. Bhatia, and the panelists to please join us on the dais.
Surgery hospitals, 38 plus years of experience and along women's healthcare. Performed more than 7.5 lakhs a year. We are proud to be trusted partner in maintaining your health.
Peerless Hospital and PK Roy Research Center is a name synonymous to trust in the healthcare domain in Eastern India. Committed to value-based management and medical ethics, the administrators focus on upgrading technology, academics and medical research. The NABL and NABH accreditations reflect the quality standards in clinical excellence, transparency, team, technology and most importantly, patient safety. Team Peerless has been and will always strive towards remaining as an extended family to its patients.
Peerless Hospital, restoring health.
Good afternoon, everyone. This is Nisha Bhatia. I am a Senior Director with PwC's Health Industries Practice, and it's my pleasure to moderate this session today, which actually resides at the heart of today's theme, which is making healthcare efficient with good governance and higher investments. Also, this comes in between your lunch. So I can only assure you that this is critical discussion, yet we're going to make it very interesting. With that, at PwC, my role is working with healthcare organization and helping them across strategy, governance, and digital transformation. And today, I'm delighted to be in this conversation with our leaders who are actually shaping the healthcare delivery on ground. With that, let's begin our discussion today. We all know that healthcare today is witnessing three major trends. The number one being shift towards longevity. The healthcare institutions as well as the pharma companies are focusing more on prevention rather than on treatment. The buzzword is longevity. The next big trend, and we've been hearing our earlier speaker talk about the emerging technologies, the AIs, Gen AIs, agentic AIs, robotics in providing care. And the third trend that we are seeing is about personalization in medication and anytime, anywhere care. Care is coming to the patients at their home. So with this trend, healthcare efficiency today is no longer only about infrastructure, technology, and scale. Now, what really differentiates a stronger and resilient healthcare institution is how well they are governed. And which means that how the decisions are made, how, how the accountability is decided, and how the trust, which is the important lever of governance, is being built with not just the patients, but the professionals, partners, as well as the investors. And as we see that the hospitals are increasingly adopting data-driven models, AI solutions across the care continuum, it is becoming all the more important to manage the data privacy, protection, and responsible use of technology, which becomes the central theme of governance. With that, we have also seen that across the healthcare value chain, right from the critical clinical care to nursing operations to hospital management and even patient engagement, governance acts like an invisible architecture that really determines efficiency, outcome, and sustainability. With that, let's begin our discussion today with our eminent panelists. So let's begin by, ma'am, you yourself. What is that you see on ground in terms of governance? From a nursing leadership perspective, how does good governance translate into better efficiency, consistency, and patient's outcome on the ground?
Thank you very much, ma'am, for asking these questions. We all know that in healthcare organization, nurses play a very vital role. The 65 to 70% of the employee belong to the nursing fraternity. So, calling the good governance. Now, when we talk about the good governance, definitely we understand in our healthcare organizations, if the governance is good, the laid down policies, the standard operating processes will be strong. And that standard operating processes, when it's been percolated or it's been trained by the nursing fraternity, those who are working at the bedside, as well as holding the managerial role, if they know, then only they will be able to deliver. And by doing so, the nurses will feel more engaged. They will feel that yes, they understand the process and accordingly the care to be delivered to patient. And in this way, the retention will be better in the organization, as well as the just culture which we talk about, that if there is any incidents, without any fear or without blaming the person, but understanding where the process has gone wrong and understanding, correcting, doing the root cause analysis and taking corrective and preventive actions, and so that the next time such should not happen. So this, when this governance is good, we will be able to understand and do. And this only motivates the nurses to take more accountability on the ground, especially at the bedside, those who are working, where the seniors, those who are in charge, team leader, they play a very, very vital role. From a top-down culture, when these processes are being set, is the responsibility at the ground level, the supervisor, nursing supervisors, in charges, they must train the nurses, those who are just joined very freshly or maybe having few years of experience at the bedside working. They must know what is the process that is being changed and what are being expected. Then only will be able to achieve patient centricity in the organization. So that's the way I must say the self-governance play, a good self-governance
And just to extend your thought, how does the standardized care, because compassion is a very important element when we are delivering care. So when we are achieving standardization with help of governance, how does we still, don't lose on compassion?
So, it is, if you talk about the compassions, when a nurse, she passed out from an organization, joins in the clinical area, when she is witnessed that her in charge, her team leader is providing care to patients scientifically, communicating, understanding the patient need and delivering the care at the bedside. And so the same culture will be learned by the fresher nurses, those who are posted in that particular area, be it a ward, be it a critical care or an operation theatre. So when she will be witnessing their seniors are doing, so obviously they will understand, yes, this is the way how I need to communicate, I need to connect with the patient, and I need to deliver the care. So and she will have such kind of accountability or such kind of confidence in their mind. And that's the way the compassion comes, the empathetic way of understanding the patient when they see their seniors are doing so.
Absolutely, no, that definitely makes a lot of sense. Mr. Joydeep, I would just like to add and understand more from, yeah, absolutely, from your experience, where you have seen, in your area of work, governance framework directly improving patients' outcome or workforce efficiency.
Thank you very much. First of all, I'd like to thank everyone, BCC&I, for getting me here as a panelist and such an august audience. And I've heard in AI and everything, and so enlightening. Thank you very much for getting me here. Look, this is a vast subject, clinical governance, and I just love to talk about clinical governance. Any governance, I'll just give a little prelude to that. A governance, clinical governance starts with a vision. If you do not have a vision in life, you cannot do any clinical governance. Standardized cares, patient care, everything depends on the vision. So if I have a vision in life that this is what I want to do for this hospital. By the way, I am a clinician myself. I have been an ENT surgeon, 15 years. I did practice. I came to clinical governance because I love the governance side of things, not just for the sake of it, but for treating my patients and thinking that this patient is one of my own. Unless we have this, let us not talk about governance, because governance doesn't work. It is not a thing where you are just saying that I do governance for standardized practice, for this and that. Once that vision is locked, everything else falls into place. Then the decision making, right? How do you put the governance in place? And biggest stakeholder in governance is the workforce, yeah? The people, the staff, the nurses, the clinicians, the paramedics. These are the people who are your main stakeholders. If you have driven that vision of governance to them, and that's a huge statement, not just for putting posters and stuff like that, then only that dream gets fulfilled. So your question when you ask that governance, how does it percolate? Name anything. He spoke about AI, EMR. What is this? These are all the things that we are thinking that if I put these things into practice for that workforce, for that sect of people, for the patients and the people who are coming, and mind you, in hospital, they don't come for fun. They never come for fun. And that is the vision. If we do not have, nothing would work. I'm 33 years in this business. I've worked in New Zealand for 16 years. I worked in Medica. Dr. Alok Roy, sir, if he's here, I worked with him. He was one of my pioneers who had shown me the dream that we can work in India. Now I'm working in Narayana. I worked for 9 years. Now I'm working for Ruby Hospital. It doesn't matter where you work. The dream is there that I am doing work for them. So if you ask me that how did it percolate, ask me where it did not percolate.
Yeah. Where are the gaps that you're seeing currently?
So the gaps in terms of governance where I have seen is, first of all, like I said, that if I am to, suppose a patient has come to my hospital in the OPD, right? And I make him sit, and the doctor did not come in the chamber for 45 minutes. Is that a good clinical governance? I don't think that's what it is. So you have to have a waiting time, right? You have to start something so that doctor comes on time, the patient is seen by doctor on time, and we have seen the patient, the satisfaction of the patient is good. He thinks, yes, I have been looked into. And one of the stumbling blocks is what you have said in terms of EMR. A lot of times when I first started EMR, they used to say, would you look at the patient when you are doing typing in? And that was a big question, that are you typing in or looking at me and putting a stethoscope on my chest? So that is how the gaps were. And that's where, dictaphone typing came in and all those kind of things came in. And that's where AI, EMR has given a frog leap to this whole momentum of patient care.
Absolutely, absolutely. So the technology has definitely brought in a lot of efficiency in the way we have been managing care. Now let's move to you, Dr. Pinaki. In your experience, where have you seen that the governance most clearly influences clinical efficiency and decision making? If you could cite some examples.
Thank you very much. Thing is that if we want to talk about the clinical efficiency does not restrict it only to doctors and patients and its outcome. It is almost is a holistic team approach that we have to proceed. As Madam already said before, the nursing compassion and other things in about. And if you consider the team, it starts from the doctors, ends with nursing staffs and the non-medical staffs all in the hospital. Because every touch point in the hospital is important to improve the clinical efficiency. As Sir has already said, the waiting for the doctors is obviously some patients has come with a problem is there, and we need to revisit again the patients. We have to need to treat the patients again. And the patient needs to have a earlier attention for the clinical treatment. Obviously, if the patient got the earlier attention, the patient can be much more in better stage if we attended after 45 minutes and 46 minutes. Problem in our country is that idea and awareness regarding the healthcare and the problem which need to be addressed, which no need to be addressed, is very poor. Yes, it is better than before, but right now, still it is poor. And in case of clinical efficiency, that's the governance will come in case of patients who are admitted with us. So the thing is that 2 to 3 things is very much required. So idea of a patients to get cured in a hospital, not to stay for a long time. So obviously the same idea should be considered by the healthcare provider also. And for that we have to adopt 2 things, and some things very clinical talents, starting from doctors, consultants, and nursing staff, whoever is working. Is clinical talents, and that has to be very precious, that we have to choose the very good clinical talents for that. And efficiency, and we'll add on with efficiency that the digitalization of the things. I can example one or 2 things over here.
Sure.
So these things, now technology has advanced in so many places, in so many ways. And previously when we used to treat infected patients, we have to wait for so many days and so many times, 7 days, 8 days time to get the culture. But other things is that, and the valuable 7 to 8 days of his life went, and after that the outcome is very poor things. And now the time has come when we could reach the treatment point, we can identify the causative agents so early, we can treat it in the day, within 24 hours. So advanced digitalizations, advanced technology helping out. So I was hearing out this Metulina is very good. If I have not seen it the first time, we are hearing about it. So if it can also help us in understanding the facts, so understanding the doctors, so to work with, also the nursing staff as well. So, and to guide this, all the efficiency of the clinical system, we have so much programs in place. So these programs we call accreditations programs. Nursing is having dedicated nursing excellence, and doctors hospital as well. Previously, we used to have these excellence awards, but didn't have a monitoring system. Now this accrediting body started monitoring system. In every quarter, you have to submit this data, these things and that.
More accountability.
So these are type of governance with good clinical knowledge and good clinical talents, and also obviously advanced technology. We can reach to an extent the patient can be benefited. Our idea is to keep the stay low, and give the patient outcome most affordable benefit.
And would you like to highlight that in your experience where you have seen that, governance unintentionally can also slow down clinical process?
Unintentionally?
Yeah.
Oh, okay. So see, governance, if you can say the unintentionally is the governance getting slow. So right now the one thing is coming in my mind, is there for transplant, if we go for kidney transplant, the things. So if it is not, if somebody is doing the unrelated transplant, something is out of lava and affections as per Indian Transplant Act, organ transplant act. So lava and affection anyone can donate, and that needs a state sanction. The state sanction is almost as a governance. They judge it, they check the backgrounds. Is a huge panel over there who sits and discusses the patient relatives as well as the donor to stop and unfair trade practice. But it takes huge bureaucratic time. So that is a queue is also there. So many hospitals are applying for it, and they have time. And this type of governance framework to judge and framing things ultimately is delayed in sanctions and other things. And that's why the patients who is waiting for the transplant to get rid of this disease process is waited, and something can happen also for that. So this type of governance things is required, very much required, but these things unintentionally slows down, so which can be corrected if the state systems or state machinery works better way.
Absolutely. Now, thank you for highlighting the gaps. Mr. Banerjee, let's move on to you and understand from your hospital management standpoint and in your area of experience, how does governance shape operational efficiencies and patient trust? Because trust being the important lever.
So, operation. First of all, thank you for this important question, and good afternoon, all the healthcare professionals present here. Operational efficiency and patient trust. So, these are all related with the good governance, definitely. And good governance from the view of management point of view or management lens, this is somehow like brings clarity, consistency and control over the system. So management can take this good governance as a tool like a strategical watchtower to control, see the entire system. It's not about just clinical or administrative, it's a completely foundations of the future Indian healthcare system. So good governance is very required. So we can take the examples of the good corporate hospitals, how they are scale up their hospitals, their standalone unit, their other unit, their expansion to the other cities. These are all depends on the good governance. Because when a single standalone unit is there, this hospital or a unit is running a very good condition or very well stable, everything is, the financials, the economics are very good. Reason is that the presence of the leadership is there. But when, Absolutely.
Yeah.
So the presence of leadership is there, but when the organization scale up from 100 bed to 300 bed or one unit to another unit or expansion to the different cities, so it's not possible for the leadership to present everywhere. So in that case, a good governance is there. Governance means a protocol, a SOP, which will be uniform to the entire unit, entire system or entire hospitals. So when there is a operational efficiency, definitely there is a good outcomes. So when there is a good outcome, there is a trust, and when there is trust, there is a revenue stability, and which is most important for a healthcare system right now. So it's not like that governance is visible everywhere in the hospital or in the hospital lobby. So it felt when our patient move in our hospital, inside the hospital confidently, and this is entirely depend upon the good governance. And it felt when there is a admission, not only admission, smooth admission. When they have a good billing, so it's not a good billing or good discharge, it's a safe discharge. And when all those things filled by the patient, so this will bring the trust. So this is the totally operational efficiency to the trust of the patient. And this is the base and foundation of healthcare right now.
No, absolutely. Governance clearly touches each and every layer of hospital functions, and you clearly highlighted that it also plays a role in enabling expansion and in your future partnerships and funding discussions. Would you like to highlight, what governance capabilities is, like pinpointing or something, and citing as an example, which ones become most critical to manage complexities and reputation? I just want to extend your thought.
Reputation totally depends upon the trust of the hospital, which is not built in a single day, but in a single moment of time we can lost our trust. If anything bad happen with the patient, the experience is bad, then there will be a loss of the trust. So how we maintain the trust, how we maintain the reputation of the organization is totally depend upon the ACPs, the protocol that is called the good governance. So in terms of investors or the partners, when anyone is looking for any kind of partnership or any collaborations, normally they are not asking how many number of beds you have, how many number of consultants you have, and what kind of equipments you have. Now everywhere the outcomes are almost the same. Everywhere the skill-based, evidence-based medical practices are there. The quality of equipments, beds, the skill, the training programs, almost every hospitals are followed, and there is a protocol according to NABH and other accreditations are there. So the most important, the investor or outsider, whenever as a corporate hospitals, when we are looking for some collaboration with the district hospitals or district player, we are normally asking, never ask about the number of bed size. We are asking about the protocols, the systems, what is your mitigation plan, what is your other SOPs to maintain the hospitals, departmental protocols, the programs, clinical programs. So these are the questions that normally people are looking for this first. Or if they are not comply with all those things, examples are there. Past lots of single standalone hospitals, they are performing very well when they are performing a standalone. But once they are trying to scale up their organizations, they fail. Why they are fail? Because they fail to replicate their system. And why they are fail to replicate their system? Because they won't follow the same protocol to the different locations. So these things are very important to comply operations, to comply with the requirement of the investors, because investors are not looking, absolutely not every time looking for the size. They are looking for the quality. So whatever the amount they invest, they funding to that organization, how they can utilize. So increasing the bed size, bringing good infrastructure, bringing a good consultant, everything's are there, everything's are placed on there. But if we haven't the good compliance or protocols or governance, this will be a disaster.
No, absolutely. So good governance is definitely an enabler of higher, sustainable, long-term investments, and you've clearly highlighted the signals that investors are looking for, not just the beds, but the quality, the protocols, the systems. So that is becoming more and more important as we seek for high investment and as we look at
good governance is like a safeguard of the fund, the investments. So we can take that at a single note like that.
No, that's brilliantly put. So I think with that, you've already highlighted the signals now. Would you like to, Joydeep sir, if I would just move on to you, how do we identify, at what maturity, or how does the governance maturity, influence investor confidence and partnerships and long-term funding? So
yeah, look, like he said, is absolutely spot on. I can speak from clinical governance point of view. When we say, for example, have a talk with some other hospitals, tie-ups or anything, what they ask for is how you're matured. Like, for example, from my side, if I say, what's your mortality rate? Okay. Now, this question, when you ask, most of the hospitals, I can tell you one thing that we are imbibing slowly. If I ask you, what's your mortality rate to any hospital? Trust me, first they will say, let me hide it under the carpet. We do not want to say what exactly our mortality rate is for various reasons. Trust me, this is not just one hospital, because they will think, hang on, my mortality rate is so high. They will just pick and say that your mortality. But trust me, mortality meeting when we conduct, when you say maturity of an organization, 10 years back when we used to say we were not standardized care, like he was saying. But now standardized care protocols if one hospital has, if you follow that to a T, with the aid of algorithms and everything, you do not have to hide anything. Everything will come up. As the maturity grows, you add more clinical protocols, more algorithms, more evidence-based studies. Obviously, your mortality rate starts to go down, and that's the real thing that is coming down. You do not have to hide anything. Infection rate, you have, if I ask you someone, what is your VAP rate in your hospital? 0, 0, 0, 0, 0. Fantastic. Trust me, I have done JCI, and JCI people come, they don't ask you what is your rate. They do tracer for the near misses, and they dig out the file, they will look into each process, and they will pick where you missed or you tried to cover up, or knowingly or unknowingly, right? So that's what I say, that people who have done JCI is a step up. No offense to NABH. Now 6th edition of NABH, if you see, very much like a JCI-ish kind of thing that is there coming up. Like again I first said, if your vision is to really go for patient care, real, other things get redundant because they become imbibed in your system to improve. Your system matures. So acceptance, thinking about what the world standard is, and real problems, if you look into and try to mitigate rather than going into noises and stuff, is when the system matures and, you know, outsiders, insurers, or, you know, other people coming in, they respect that. They look into those kind of evidence, and that's how hospitals mature.
No,
Thank you.
absolutely. So, you know, we are trying to say that weak governance is definitely becoming an constraint, growth constraint, increasingly becoming a growth constraint. So, and as we've seen that as, you know, hospitals scale up, you know, and they have, you know, increase in investments, the complexity also grows and governance becomes all the more critical. Now, we've seen that, you know, how tech has enabled healthcare today with the growing digital tools and AI solutions across the care continuum. So, ma'am, how, in your experience, would you like to highlight some digital initiatives where, you know, you have seen it has improved efficiencies in your...
So the first thing which comes to my mind now, as per the questions, that the robotic surgeries. You know, when like we are doing robotic cases, we have seen that while doctors are preferring more now to go ahead with the robotics, and with that, the patient outcome better, there is very less blood loss, pain management is much more better, patient doesn't require more and more analgesics, very minimum pain, so pain score, it remains around 0 to 2, not more than that. So that and the patient's average length of stay is very less. Even the first day of lab chole patient can go home by evening. So that's one of the most important thing. Another, this EMR. Now, when the EMR has come to most of the hospital and many are using for long period of time, it's OP or IP areas. So that is also, you know, saving lots of time. And moreover, the datas are there. Once you just click the computer, you can get the entire detail about the patient, which is also enabling the nurses for better understanding of the patient's details. Again and again, there is no need of asking. Even the patient's file goes to MRD, the nurses can click the computer and understand if patient comes back to us, readmit. So that's very easy way of, you know, this digital health which are adopting by the hospital and to understand the patient processes. Coming to the, we focus on very much the antimicrobial stewardship program. And, you know, nurses play a great role in it. If nurses are empowered, if clinical governance is very strong, nurses will be empowered always to the, to understand from the clinician if there is a restricted antibiotic is written, why the doctor has prescribed that, the justification form needs to be filled up. Whether you go ahead with the digital filling of the forms, but the nurse must know why this antibiotic, restricted antibiotic is being prescribed. So that if the justification, if clinician is at that very moment is not written, they will intimate to the pharmacy, that the pharmacy will understand and may not dispatch till the justification is given, because we are aware, most of us are aware that maybe by if the justification is not being done and you know, randomly the antibiotic is used, maybe by 2050 we will not have anything to treat the patient. So that's the era is going to come. So that's why it's very important for the nurses to have their mind full, you know, cooperations, and as well as the clinician also cooperate. And if we have a very good clinical governance, nursing governance, then only we'll be able to achieve. So that is what which I would like to highlight, and that digital health brings lots of, you know,
absolutely.
Help us, enable us to go ahead with this.
So digital, you know, brings a lot of efficiency
very
and also
much,
improves patient
efficiency.
trust. But with
Yes.
that comes a lot of risk. Now, Dr.
Absolutely.
Pitaki, you would like to answer, you know, what are the risk part, you know, in terms of data privacy, you know, who takes the accountability? Who owns the accountability for data, privacy, and all the risk which comes out of these digital initiatives?
See, data privacy in hospital, actually the primary heading comes on a bucket of the confidentiality. But if we talk about the clinical data. So, if you say who takes responsibility in particularly pertaining to this topic and to the pinpointing the person or departments, yes, is primary custodian is information technology, and so obviously it's going to be associated with other disciplines as well as, but as a whole hospital, as any individual, as a hospital is responsible to take care of the data, of the things. So data protections breach happens. It doesn't, that is not happening. See, when we start tying up, doing the interfaces with the other softwares, and they are also getting the interface and access to our software.
Right.
So one thing is that, so I can make you understand, it's very much used, even it is actually using, this uses happens in almost every hospital. When we talk about the packs, we don't have a centralized pack. There are no hospitals generating its own packs. But we are transmitting data through packs to doctors, and we're transmitting data to everywhere else. If the authority, the vendor, actually who manages these packs from behind, if they want to breach the data, they can anytime they can do the breach the data.
Yeah.
So that part is hospital has to be some good governance, legality has to be imposed, because country has laws and they say we have to take these laws in place.
Absolutely.
That's all.
And we're seeing a lot of work is happening in this area where we're trying to ensure.
DPDP is something.
Yes,
DPDP
absolutely.
is something is very.
Is
somebody
in
mentioned before.
Yeah, absolutely. So that is what is happening. To protect the data. And definitely, it will balance speed of innovation with safety and responsibility, and everybody owns today in the organization. Accountability resides from the clinician to the leadership, and also to our...
Exactly.
Yeah,
same
yeah.
thing. Because
So,
right now, I just love to mention that like now the government also wants to have an interface with each and every hospital to get the healthcare data. Thing is that there is so much interface, we will start doing it, so much risk of generating a leakage and breaching of the data will happen. So government rightly pointing out the way, rightly the digital, the era we're actually moving in.
Absolutely.
We need to have a DPDP type of laws and things to be in place.
yes, so DPDP Act is further strengthening data protection and privacy, and also ensuring that, the hospitals are properly governed.
It's not about the hospital, in case of all industry across.
Yeah, absolutely. So I think with that, let's have a rapid fire round, ma'am, and everybody. One question to each one of you. We'll start with you, ma'am. One governance practice that has improved efficiency in your hospital. One line, one word, very quick.
So if you say only one line of clinical practice, that is a very strong training, which helped us to develop the nurses to take up more accountability and provide care with the patients more empathetically. So continuous training and very strong induction program.
Okay, brilliant. One governance gap the healthcare leaders must urgently address.
One governance
One
gap.
governance gap that leaders must urgently address, like in a word
I
or a
would like
sentence.
to come back again regarding the renal transplant and any organ transplantations. There is a huge gaps are there because we are ignoring these gaps in different way. We are adjusting all the systems in our own way. We have to get it adjusted.
Brilliant. Sir, what about one change that would unblock higher investment in the next 12 months? One change in the whole governance and the way hospital is managed today.
I think, look, this is a very polemic term, bureaucracy, in hospital leadership, like I said, if you have a good vision, if you can break down that bureaucracy, and that comes down to the leadership team, if we can have a much more, and like I again bring it to you have investors, I had investors where they're asking for some tricky things, and they have done a study. Like I said, the VAP thing, again I'm bringing it to you, if you tell them I had zero VAP, they are not going to accept that. So I think ethical way, and transparency, if that exists at all, the best way we all can do. Now here, if you say I am this hospital, he is that hospital, that, it's not going to work. This is one team where we are trying to provide good, affordable care to the patients. 80% patients still they're improvident. If we can break that bureaucracy, inter-hospital, that kind of hush-hush kind of a thing, and bring a universal kind of a data where we proclaim, yes, this is what we can do. I think that kind of transparency will bring in more of these investors, I think. Thank you.
It's the same question for you. What is that one change that could unlock higher investments in the next 12 months?
Okay. So everywhere when there is a word investment and investor, so everyone run the organization to revenue lead strategy. So if you want to change that, we have to shift from revenue lead strategy to the volume lead strategy. If we go for the volumes, then definitely we can provide affordable healthcare to everyone, and we can say that health for all. So this is important things. If we can change this mindset, definitely will change the healthcare of India.
So I don't know what is the format of this panel discussion, if we can invite questions or we can just wrap up. Should we take questions or we'll any questions from the audience for our panelists? You have any questions or you would like to connect over lunch? Because I'm sure everybody is hungry. So with that, we can summarize and say that today's discussion really reinforces a simple but a very powerful message that efficient health systems are built by not spending more, but by governing better. And good governance builds trust amongst patients, professionals, partners, and investors, and trust improves efficiency. And trust also enables a long-term investments. So as we see that the healthcare continues to evolve, governance must move from background to boardroom, where it is used as a strategic lever for responsible care and sustainable growth. With that, let me end today's session. Sure, and we have one more concluding line.
Yeah, just one thing, make the patients your partners. Treat them as your own. That confidence from the mass is the biggest transparency that you can have. You talk about feedback from internal, take their feedback, get town hall meetings with them, see what they want. Okay, otherwise this robot program, I'll finish up, someone mentioned robots. Is robot a cheap thing? No, it's not, right? What was robot for? Advanced cancer patients, right? Now people are doing normal lab chole on robots. Is that a wrong thing? No, it's not. But now people understand, I will put few more money in for doing the robot for a better clinical outcome. Even it's in a couple of lakhs more, and I've seen that for a simple lab chole. Gives us the answer that yes, even with that extra money, they understand that I'm going to benefit. It's because of sheer relationship with that patient. So doctors, individuals, whoever we are in this profession, build a good relation with the patients, give them a good clinical outcome. This is the best transparency you can have, I think. That's all. Thank you.
No, with that, thank you everyone. We've beautifully summarized. Thank you everyone. Thank you each panelist, and thank you all the members for your participation, and have a good day ahead. Thank you.
Thank you, the moderator and the panelists, for joining us today, and special thanks to Nisha for traveling all the way from Mumbai for today's program. I request Ms. Dolly Bishash, the Chief Nursing Officer from Fortis Hospital and co-chairperson of the National Health Committee of the Bengal Chamber of Commerce and Industry, to please present mementos on behalf of the Bengal Chamber to the other panelists and the moderator. To Ms. Nisha Bhatia, Senior Director Health Industries from PwC in India. To Dr. Jaideep Bhattacharya, Chief of Medical Services, Ruby General Hospital. To Mr. Indrajit Banerjee, Group Head and Associate Vice President Marketing from PLS Hospital. And to Dr. Jaideep Bhattacharya, Chief of Medical Services from Ruby General Hospital. I request Mr. Shayantan Chatterjee, Partner, PwC India, to please be on the dais. To
to Dr. Pinaki Bandopadhyay, Medical Superintendent from HP Ghosh Hospital. And I request Shantan to please be on the dais to present a memento to Dolly Madam. Thank you all for joining us today.